this doesn't break it again. Okay, there's movement. Feel good about it. All right, so week 2 of research methods. Let's catch up real quick on some light housekeeping issues. So one, you need to make sure to send to me your certificate of completion for human research. A number of you have already done so. If you've emailed it, you are golden. If you have not yet completed it, I urge you to do it ASAP. It is due, I think it's next week is when the
Yep.
deadline. I was just gonna pull it up just to make sure that I'm not spouting off nonsense to you guys. Right here. Yes, by week 3, the human research certificate needs to be submitted to me. So make sure you're with that as soon as possible. The next piece is the article critique. Now, it seems like there was some challenges with that assignment. Let me share my screen so you guys all see what I'm seeing. Can you guys see Course Connect? Yes. Okay.
Yeah.
So I think the issue was when this class was transferred over from the fall semester, it just copied over random dates. So that's why I think it showed that it was due like February 13th or some nonsense like that. I am seeing though now that you guys have been able to submit it, so it's open, and I took away the due date. So the goal was to have it completed by the end of today. That's what was on our syllabus, to have it completed by week 2. If, however, you were confused because there was some misunderstanding between the syllabus and what was presented on Course Connect, totally fine. Again, I want to show grace. There's no problem with that. Just reach out to me and let me know. And I think I sent an email to everyone about that also, that we can extend it through Friday if necessary. Again, the article critique is not meant to be a challenging, well, I don't want to say that it's not challenging, but you're not supposed to produce a ton of writing. I guess that's what I mean to say. So the goal is to read the article, digest it, go on the syllabus and copy and paste the questions that I included and fill in your responses and try to make it as close to 2 pages as possible. Now, I've had students ask me, like, I'm right there at like 3 page in a paragraph. That is fine. I'm not going to be docking points for that. I just don't want anyone to be like, here's my 15-page review. That's far more than what I'm looking for. And I want to be protective of all of your times as well as mine grading it. So 2 pages, the idea is you're supposed to be able to glean what is most important from this article that is necessary for me to understand it, and then answer the questions. Okay.
So,
Questions about that? Yeah.
sorry. Is it okay if we were reading some parts of it? Like I was on, I think the fourth study, and it was a little difficult to kind of unpack what they were saying. Is that okay?
Like you struggle to understand the methodology, or?
Yeah, I think so.
Yeah, so then that could be part of your discourse too, was that it was really complex and kind of hard to understand. You could certainly do that.
Okay, I just wasn't sure where they were talking about like the excitement study and then the work study, and then they were talking about laughing. That kind of
Threw you off.
I was reading and I was like, what's going on?
Yeah. Okay. Yeah, and that can be part of your critique of it, right? So that's no problem at all. Yeah. Okay. The other thing I want to make sure that you guys pay attention to, so make sure you complete your certificate of human research, that you complete critique number 1 on this O'Brien article, which is linked here. And then make sure you engage on this discussion thread that's called Choose Your Topic. Again, I want to make sure that you guys are looking through here and submitting some of your ideas. If you have a group, you're like, hey, these people and I were going to be in the same group. Totally fine. Just make sure you write on there, we are in a group and this is our topic that we'd like to cover, so that we don't double up on topics. So there's been some good traction on these so far, but there are several of you who have not engaged in this. So I would encourage you this week to do so. Think of a fun topic. Yeah, go ahead, McKenna. And go ahead and speak up, because I happen to see you going like this, but I might not always see you guys. Yeah.
Okay, so for the one on Kyle's, I think there's 4 of us that want to do the same topic. Do
Yeah,
you-
the one over here. Yep. The top
Yeah,
number 2, I think, right? Yeah.
yeah.
Yep.
Kyle is actually in my group now. So,
Oh.
I think someone else commented. I was gonna get back to them and see if they still wanted to be in it too. But we were gonna do the Zoom University and eating habits, basically.
Okay, so it sounds like, so Ashley, I would encourage you that maybe I missed yours. Are you on here?
No, I have a
It's
different
on the
one
next
that I
one.
started.
Oh, okay. So go on here. Oh yeah, here you are. Okay. Oh, and it looks like McKenna, you responded to that one as well. So go ahead and write up, like, so Ashley, if you and Kyle have already like, okay, yep, let's do this. And then other people can still join in because there's a total, I think we're gonna do 4 groups of 3, 1 group of 4, or 3 groups of 3, 1 group of 4, I think.
Okay.
8, 10, 12, because there's 13. So yeah, let's plan on doing that. 3 groups of 3 and 1 group of 4 students. So as soon as you have everything kind of decided as your group, please note it on there so that I know. I can be like, okay, this is one group, this is another group. That'll help facilitate things for me as well in terms of scheduling when I set up our conference times. Okay. McKenna, I'm not sure that I answered your original question.
Oh, that's fine. I got it.
Okay. All right. All right. So again, just click on here, make sure that you talk about which topic you're interested in, and then talk about who you'd like to have in your group as well. Okay, so the goal for today is going to be for us to cover lecture 2, which is actually lecture 1, but it's chapter 2. Anyway, we're going to cover that. We'll probably take a short break. And then what I'm going to encourage you guys to do, or have you guys do, I should say, is I'm going to make sure the link is on here. And I think it's hidden right now. So I'm going to need to add that. We're going to have a link on a TED Talk by Goldacre that discusses exactly, I mean, really like the entire chapter is nicely summarized. And there's going to be a discussion thread for you guys to engage in for the rest of the week. So it doesn't need to be all today, but it needs to be throughout before we have class next time. So before Wednesday of next week, make sure you're engaging in this. And here's the reason why I'm doing it this way. I have discovered that through these Zoom conversations, oftentimes there are some students who are not as participatory because this is like and whoever's interested in doing like online learning and what that looks like and differences, I think this is a major difference. People's participations looks different in an online environment compared to an on-ground environment. So whereas you can kind of pull up a little bit more of the pressure when you're all in a classroom together and go, okay, what do you think, right? It's harder to do in an environment like this where there's a lot of people I can't even make eye contact with, which is fine. That's kind of the virtue of Zoom. So that discussion thread will give everyone a voice. So the goal for participation, because participation is also part of this class, is going to be to engage in the discussion thread. And by what I mean on engage is respond to the prompt, which will ask you some questions about your thoughts on the video, and then respond to other people's prompts as well. I'll have a very clear expectation written at the top, so don't worry about that. It'll be all out there. Okay, how does that sound? We good to go? Okay, now let me share screen with the actual lecture. Okay, can you guys see that?
Yep.
You can. Okay. Do you see my cursor? Okay, because I have 2 screens and I never know which one shows my cursor and which one does not. Okay, so the first thing we're going to talk about for research method, that's really one of the pivotal parts of research, is understanding where we get our information from. Just, little spoiler alert, research is best, right? So asking your grandma, what are your thoughts on whether I should have a certain vaccine? Probably not the best resource, right? She doesn't have all the information that a researcher might, or that a published paper might, although we'll talk about that as well. Okay, so the goals for this particular lecture will be to decipher the difference between looking at research to get your source of information versus experience, looking at research versus your intuition. So you may not have any direct experience, but you have a feeling that it should be one way versus another. How to know who to trust on a particular topic. So the issue of authority, who should have a loud voice in a way or should be trusted in terms of having the correct information, and how to go about finding and reading research. So you guys have already seen research articles, you know, you've been exposed to them through your past college classes, but where do you go about finding them? And then what is it made up of? Like, what are research papers usually composed of? So that's the goal for today. So let's talk about experience. Let's pick something that's super like non-threatening, such as laundry detergent. Okay, so raise your hand virtually or otherwise, or say yay or nay. I'm going to try to see all of you, but I don't think that's possible because there's too many pages. But okay, those of you who use a powder laundry detergent, raise your hand or say yay, nay. Sometimes, Noella. Okay. I'm not seeing anybody else raise their hand. Okay. What about those of you who use liquid detergent?
Yeah.
I do.
Okay. So I'm hearing 4. What about those of you who use the pods, like the little capsules?
Yeah.
Yeah.
2. Okay. So now imagine you have somebody who has never seen a washing machine. This is like totally novel. They've never experienced what it is. And they ask you, what do I put in this machine to clean my clothes? You are likely going to tell them a reason why they should utilize a similar soap as yours. So what would be a reason why they should use a pod, for instance? What are some reasons why you guys use pods?
The amount is already like distributed for you.
Okay. So ease of use in a way. Okay. Any other reasons for someone else?
Not messy. It's not messy.
Not messy. Okay. So again, kind of falls in that ease of use, so to speak. It's a predetermined quantity. It's not messy. Just pop it in. Okay. What about those of you who said liquid?
I guess that's what we used at home, and that's what I use still.
Yeah. So you had past experience with it. And so when it was time for you to make that decision, you're like, well, this is what I know, so I'm going to keep doing it. Right? Okay.
I just think with the liquid, you can add more if you add more cross. So that's what I like about it.
Yeah. You're like, I'm really filling this washing machine and shoving stuff in so I can add more. Yeah, that's clever. Because I don't think you can add 2 pods, can you? Probably doesn't fit.
Yeah, you can.
Yeah, you can.
You guys are blowing my mind. Now I'm going to be spending way more money on laundry. I'm like, chuck all that. And I'm washing my kids' sheets, especially. I'm like, oh, they're all gross, right? I mean, they're not, but you know what I mean. They're kids. So, okay.
Throwing them out.
I know. So now you all had your own experience. Now, has any of you gone through the process of going, I don't know which one I should use, so I'm going to buy powder, I'm going to buy liquid, and I'm going to buy pods, and then I'm going to have, you know, my little cheat sheet and go, how did my clothes feel afterwards? How did my machine feel? How did I feel, to compare the 3?
I don't think so.
I have yet to find a class that goes, actually, yes, I have. And here are my results on this graph piece of paper. You know, that'd be a researcher's dream right there. But that is not how we operate. Most of us make decisions based on our past experience. And the problem in doing that, which again, for laundry detergent, there's no problem. You use one your entire life and never try the other one. I don't think that on your deathbed, you'll be like, this was on my bucket list. I never tried powder detergent, right? Like, no, that's not happening.
Well,
oh, go ahead.
For me, like it depends like what life circumstances I am in. Like when I was in college living at the campus, I use more like the detergent that is already wrapped in the plastic because I thought it was much easier.
Yep.
Because you, as a college student, you want to count every minute. Like every minute is worth it.
High efficiency is important. Totally. Yeah. And I would actually throw in there, and this is surprising, I'm digressing a little bit from the bigger picture, but with laundry detergent, oftentimes cost, especially in college, turns into a thing. And those pods, I think, are kind of expensive, aren't they? Or am I imagining that? I feel like they're probably more expensive than powder. Yeah.
I feel like there might be, but they kind of like you get more too. If because you're supposed to use one, so you have a bunch more than like just a liquid. Because liquid you have to measure, so you like putting more than you should.
Right.
Yeah.
Yeah,
Okay.
you can get the bulk at Costco, and that's what I get, but it's like $20 for a bulk.
Yeah. So yeah, it's not cheap. Okay. So again, most often people don't go through a comparison to go, which one is actually best? Which one do I see the best results in? And if you did, you might realize like, wow, actually the liquid one makes my clothes smell better, or they're not as staticky. I don't know. You might discover something from it. But we're picking a pretty low grade experience here. Now, occasionally in this class, I will get a student who will go, oh, I cannot use insert. I think most often it's powder. I cannot use powder because I get skin reactions. I get a rash, or my body just does not like it, or I have to use a free and clear because anything else gives me like a physical reaction. And so that is a personal experience, right? That guides future behavior. But that is very much a personal experience. It doesn't mean someone else is going to go through that once they go about it. And then the idea of confounds. So that's something else we need to talk about briefly. What do you guys think of when you hear confounds? Like, what might be a definition for it?
What did you say? Confound?
Yeah, right here, like a, well, yeah, has, it's a used as a noun.
No comparison group.
So this idea here is that the results you are getting are not due to what you are manipulating, but in fact due to something else entirely, right? So if you wash your clothes, we're going to stick with the detergent idea. You wash your clothes and you decide to use powder detergent and you develop a whole skin rash. At the same time that you tried a brand new food and a new lotion, your determination that what caused the rash was the laundry detergent may be incorrect, right? Because at the same time, you also changed two other variables. You introduced a new food, you introduced a new lotion touching your skin. So now, what is the ultimate culprit of the rash becomes much harder to know. So again, with experience, when you're just basing it on what you're going through, it is hard to parse out what is truly having the greatest impact. Whereas with research, you have comparison groups, you are dealing with laws of probability, right? So we know that out of 100, about 10 people will get this. So then we can forecast how many people will get in the future. If it's just your own experience, you're thinking this happens 100% of the time, right? Which is not accurate. Okay, so that's the difference between research again and experience. There's several more examples we'll go through, and your text has a lot. So one of them is tape. Now, are there any athletes in the class that have used tape before?
I have.
Okay, and what has been your experience with that? Do you feel like it helps, doesn't really do much?
I think it depends on like the injury. Like I tore my MCL and I would do like a deep tissue massage and then get taped after.
Mm-hmm.
And then I would keep it on for a couple days. So it kind of just depends on the injury because some people play with the tape on, but I used it as like a recovery post like massage for my tear in my leg.
Okay, that sounds so painful, Lauren. Already you're saying that, I'm like, oh,
Yeah, it's not fun.
what sport? What was it, soccer? Or?
Yeah, I play soccer.
Okay. Okay. So it sounds like positive experience, but you use it as a post-workout recovery. Okay.
Yep.
Anybody else?
In high school, we like used it for shin splints, but I don't really know if it helped at all or not.
Right. Okay. So this is another one of those that there's so many variables present. So some people will swear by it. They're like, I have to have this in order to perform if they're using it during a sport. Runners, that's another very common group of people that helps them quite a bit. Um, Again, it's a low impact activity, right? Like it's just like laundry detergent. Well, if you use tape or not use tape, it's not going to be life changing, right? It's not like, do I take a vaccine? Do I not? Do I take this medication? Do I not? Like, I'm not trying to downplay it totally, but the impact is not quite as great. But there are others who will go, gosh, whenever I wear tape, I feel so much better after, right? Like afterwards, I'm not in as much pain. But then if you start pulling it out, if it's simply based on their personal experience with no comparison group or with an inaccurate comparison group, you have faulty data, right? So if you decide you're going to wear the tape only afterwards and after a workout, then you can compare after a workout, like what does it look like? How do I feel? And it's always at the same time. But if you compare during the workout and then after the workout, or after the workout, but after your injury, you're not working out quite as hard. So then the tape seems like it's helping, but maybe it's because your workout has changed also. You just need to be really careful, right? Because again, if you're making these choices based on your experience, they could be biased in some way. They could be due to the fact that you don't have an adequate comparison group. And that's different one from the other. So the beauty of a comparison group in research is we get to manipulate a certain variable and then have a control for it. So we say, hey, you are going to do this exact same number of minutes of workout, same level of intensity with and then without the tape. And now let's measure how you're feeling afterwards and whatever that measurement may be. But you're really making it equal. Yeah, we'll talk about the venting piece in just a minute too. Go. Oh, did that not work? All right. So let's talk about this lovely example, bloodletting. How many people are familiar with this lovely idea?
Yep.
Okay. So who wants to give a quick summary what they used to do?
In the air quotes olden days, they would
Yes.
bloodlet in order to let, like, I don't think they quite knew about infections, but let things like ghosts out of your blood and stuff like that.
Right. Or let the disease out, right? So that was very much a treatment method that was deemed at the time to be very good. Like this is the way we treat it. Newsflash, they still actually use that for certain diseases now. There is a condition or a disorder where your body holds on to too much iron in your blood, and that can make you feel ill. And the way to solve that is through a blood donation, right? So it's not like you're not like spewing out blood. Like I feel like when I read bloodletting, that's what I'm imagining. Sorry for those of you that might upset, but that's where my brain goes. Instead, in this current like now treatment, they either you donate blood or it could be a leech treatment where it will suck out the blood. Anyway, fun times. Okay, so why do we care about that? Well, because they determined that this was an effective treatment, but they did not have a good comparison group, right? So let's look at our data. So my sheet's a little bigger over here, but so you could see the baseline comparison. So the number of patients who recovered that had been bled was 20, and those that had not was 10, okay? Then the number of people who died who had bled was 80 versus 40 that had not bled. Any problems with that?
The mortality rate's much higher.
Yeah, it's no bueno, right? Like, so, okay, what could be some reasons why people are either getting better or dying?
Could you
Because-
make that picture a little bigger?
What's that?
Could you make the image a little bigger? I can't really read it.
I would love to do that. And does that help? No. Can you see anything now?
It's source of information why research is best and how to find it.
Okay, so that's not what I want. I broke it, Elizabeth. I broke it. Okay, hold on. Go back here. Go here. So I think the answer is going to be no. You're going to need to look at this on
I'm
course
just gonna scooch my computer closer then.
or display setting. Swap. Is
Boom.
better?
Oh my gosh, that's so much better. Thank you.
Okay, now, but I have a question for you guys. What do you, whoop, okay, do you see my cursor?
Yes.
Ah, there's so much learning going on this semester for me also. In my last class, I was like, you guys, I want to show this video, but the volume never works. She's like, oh, you just have to click this button. I'm like, an entire year that I've been doing Zoom. And every time I go to share my screen, show a video, people are like, link here, we can't solve my whole world. Okay. Thank you for pushing me to grow, Elizabeth. I appreciate it. Okay. So we can see here this baseline of comparison, right? So it shows through these values that the 20 people who bled and got better, right? And here 10 who were not bled that got better. Those show a very similar percentage. So if you're just looking at these values alone, you're like, oh, well, might be a good idea. You change any of this data and you can see that it increases dramatically. And then you see that there's a real problem. So the main issue with bloodletting, biggest piece, is that they didn't understand disease, right? And so one person who may have gotten bled may have had a common cold, and inevitably, regardless of being bled out, they were going to get better. And then someone else who might not have gotten bled may have had like a really terminal disease. And so nothing that would have been done would have helped. So when you don't have an adequate comparison group, it is impossible to know if your treatment is effective. And you are going to get this level of variability if you look at month to month, and you will not be able to draw a significant conclusion as to whether it is effective. So that's a big take home on that one. Okay. So we talked about this just a second ago. What are confounds? So it's other variables that influence the outcome. So when we have real life experience, when we're living in the real world, it is very challenging to know for certain what caused an event. Okay. So we talked about this a minute ago, right? So if you had done your laundry with powdered detergent, and at the same time, that same day, you put on new lotion, maybe ate a different food, maybe you were super stressed out, and then afterwards you developed a rash, it's hard to know what was that led to the rash, right? Like, what's the linear path here? Was it in fact the laundry detergent, or was it the moisturizer? Was it your stress level? What was it, right? There's multiple impacts. But if you decide that it's one of those specifically that has caused it, that is a problematic conclusion because you have not controlled for all variables. You have allowed them to vary. So it would be as silly as for me to say, in order to be successful, and I'm basing this like on what I'm seeing here on the screen, in order to be a student at Aquinas, you need to have brown hair. That's ludicrous, right? That makes no sense. Well, based on what I'm seeing, that seems to be true, right? So I'm ignoring a bunch of other factors that led all of you to be Aquinas students, and I'm making a faulty assumption about that. I'm leading into a wrong conclusion as to what led to you being an Aquinas student, because I wasn't measuring things equally. So what is important when you're doing research, we talked about comparison group is going to be huge. The other huge piece is only changing a variable one at a time so that you can see the impact of that one variable. Okay. So let's talk about this quick study. So this is a study from 2002 that talked about catharsis. So the idea of catharsis is, you've probably heard this before, like you shouldn't bottle up your emotions, right? Don't squash them down. You should express the way you feel. If you vent, express, talk about how you're feeling, you will feel so much better. So he set out to have a research study that would evaluate whether in fact catharsis led to lower levels of aggression and frustration. So his study was done with actually 600 undergrad students. And what he did is he had them write a paper, I think on politics. Let me look here. Yeah, on politics. And then they were then given their paper was given to a Confederate, a fellow researcher, who read them and then provided some really rude comments about the style of their writing, their viewpoints, all of that, like super rude. Then they were randomly assigned to 3 groups. Okay, so that's a key word that should make you go, ooh, good research, randomly assigned. So there was one group that was told to then go in a room and sit quietly. That's all they had to do. Don't do anything, sit quietly. That's like the bottle up your emotion group. Then you had another group that said, you know what, here's a punching bag. Why don't you go ahead and punch this bag for about 2 minutes, okay? Third group, they're like, you know what, we're gonna give you your own punching bag, but we've also have a nice cutout of Steve, who is the researcher, the Confederate who gave all those rude comments. We just happened to have his nice big photo and we just plastered that right on the punching. You go to town, you just punch away for those 2 minutes directly on his face, okay? Then all 3 of those groups were given a new task. And the task was to provide a, you know, those sound blasts, like air horn, like, you know what I mean?
Yep.
Yeah. Okay. So they had to provide this like wrong noise. They were playing a quiz with the same guy, Steve, who provided the rude comments. They did a quiz with him, and whenever he got it wrong, they got to give him a really loud noise, right? So that's like inserting pain. No one wants that. No one wants to hear that loud noise, but that's what they had to do. And so then they had to figure out, the researchers looked at what was the rate or how long or how often did they use that air horn on Steve. And what they found is that the ones who sat quietly after those negative comments used it the less. So that's what they're labeling subsequent aggression, right? Like putting that right in his ear kind of aggressively. Those who sat down, not quite as aggressive. Those who punched a bag but without Steve's face, they had kind of average levels of aggression afterwards. And lastly, the ones with Steve, man, they went to town. They were like, Steve, I'm mad at you. You were rude to me about my political paper, so now I'm going to let your ears have it, okay? And you can see well above average levels of aggression. Okay, so why is this a good study? What's good about this?
We have all of the variables we need to isolate. Is it so the independent variable would be, well, I guess they're trying to study if catharsis works, quote unquote, or I don't know. I think I have a brainstorm here, but I don't really know how to flesh
well,
it
you're
out.
spot on. Yeah. So does catharsis work in reducing emotional distress after an event, right? That's really their question. And what is this showing us?
It does work very well.
Does it? Okay. Anybody else?
Okay, so I think the reason why this study is good is because it has very clearly defined parameters. It's you do these things and then you split off into 3 different groups. And I assume like they videotaped it so like they could review it pretty easily.
Mm-hmm.
But so the catharsis is talking out your emotions or like doing it, right?
Emoting them. Yeah.
Yeah. Okay, so it clearly shows there is a difference in regards of acting it out and then sitting quietly, because it's just so you can see a really big. And so would group 2 be, what's the control variable in this?
That is the control. That's very good.
Okay, so that's
so in a way, you're looking at no catharsis, right? No expressing your emotion in any way would be sitting quietly. You've just been given a timeout, so to speak. You go chill with your feels, but no way of expressing it. And then they show actually the lowest level of aggression. I think actually they, by having that timeout, so to speak, de-amped them. They felt less valence, less anger towards Steve. They were able to move on. So catharsis actually in this is not supporting catharsis. This is saying the more you spend time thinking about what upset you, the more emotionally upset you become. Because just punching, that is kind of taking it out, right? And they end up with an average score. I'm pointing here to my screen. You can't see it, but oh, maybe I can point here. They end up with this average score of aggression, right? Where they have a sub level of aggression. So it's below average. And you can see here, because all of you guys rocked it at stats, right? We've got Z-scores. So we know that 0 is your mean. And then here, let's be real here. Is this a large Z-score? It is not, okay, right? So we're not even looking at a standard deviation. Standard deviation is 1. So this is like a quarter of 1.
Now, so question.
Yeah.
Because of stats.
Yeah.
And so is this, could you extrapolate it to say that is a little bit of a amped up, because 0.2 is not much.
No. So here's
like,
the reason why. Yep. Yeah. And if we were doing a study on 25 people, I'd be 100% with you.
Okay.
Yeah, we're gonna not make a big deal about this because this is such a small sample size. We really had like 8 people per group. This could be random error. The differences are not that big. The effect size, your D would be very little. But because this was with 600 students and there's 200 students in each group, this is more meaningful data, right?
So is the catharsis getting your feelings out, so like punching, or is it both sitting quietly to reflect and punching?
So the basic definition of catharsis is you have an emotional reaction and you are letting that emotional reaction out. So in this study, it's exemplified through just punching the punching bag or punching the punching bag with Steve's face on it. So this would be the same as if you had a really horrible day, you're really upset. Oh, you've had a terrible breakup. Let's go with that. Like that's really emotionally valent. And then if you just randomly write a post on Facebook saying like, guys suck, they're the worst, you know, whatever, you feel bad, girls too, both, either, all. Versus you talk to somebody you know who knows the person who just messed you up, and you go into a ton of details, right? That's highly personal. You're getting far more details about it. You're more emotionally involved with that. That would be punching Steve's face, right? That's a more emotionally valent catharsis than just punching bag. But both would qualify as a form of catharsis because you are emoting how you feel. Whereas sitting, and I'm calling it a timeout, that I don't think that's how they talked about it, but just sitting with your feelings, bottling it up, not giving it attention, that would be the opposite. That would be not engaging in catharsis.
So when we're looking at this,
Yes.
it's like because, okay, I think I understand a little
So
bit more.
their level of aggression, which again, that would be measuring the outcome.
Yeah.
Did the catharsis lead to you feeling better, being able to move on, right? And it shows actually after the punching incident, you have higher levels of aggression. So it only worked to amp up your emotionality. What are you going to say, Kyle?
Now, so from this,
Mhm.
would it be like okay to say that this is leading you in the direction of like, if you get into a breakup, the
Yeah.
healthiest way, quote
Oh
unquote,
boy. Oh boy.
is
Then
to just sit quietly and like
you're-
deal with it?
you're breaking me. You're pushing me in a corner here, Kyle. I'm not going to give that advice either. Well, Dr. Waltell said talking is bad. You should bottle up all feelings. Yep. Her and her clinical degree.
You know, the study.
Right. So based on this study, which do you guys remember the seminal study on Bobo the doll?
Yeah.
Okay.
Yep.
Right. So Bobo the doll, similar idea. Like I'm going to watch aggression. I'm going to mimic aggression. So I would say that's actually one of the confounds of this study. So this is a beautiful study because it's randomly assigned. You've got good participation, like in terms of number of participants. Everybody experienced the same thing, but punching as a way of being catharsis, I would say impacts your aggression because you are engaging in a physically active, kind of an aggressive behavior to punch, right? That's not like petting a dog, right? No, you're like punching. And much like in Bobo the Doll, that experiment where the children viewed a video where they were punching and then given a video where then they're punching, does that show learning or kind of this priming for aggression? I would say that's a possible compound. Yeah. So no, you're not putting me in that corner of saying just don't talk about.
Okay.
No, not gonna go there.
Okay.
All right. Does this make sense, everyone? Okay.
Thumbs up from me.
Okay. So again, the heading is research is better than experience. I think, okay, this is a clear evidence of that. With research, another huge piece of it is that we use probability. Now, it is possible that you decide, I am going to buy a car. I am going to go like this, not look at any research. I'm just going to pick whatever looks good, right? And you end up buying whatever car has the lowest reliability score according to Consumer Reports. I'm also not going to put my foot in it and name a brand of car and you're like, hey, that's my car. Don't say that. But whatever car you have in mind that you're like, oh, that's known to be a crappy car. Imagine you buy that car and it lasts you 250,000 miles. You hardly have any repairs on it, right? You could say that's the best car ever. And in your experience, that would be a true and accurate statement. However, the laws of probability tell us what? When you look at a particular product, do research on it, test out how it does after 40,000 miles, 80,000 miles, 100,000 miles, whatever they do at Consumer Report. And then you get like 20, 40, 50% of cars that have high cost of repairs because they're breaking down. They're going to tell you, you probably should go in a different direction if you're trying to get a really reliable vehicle, right? So the beauty of research is because it has comparison groups, because it uses multiple numbers of product, they're able to give you a probability as to how likely something is to happen, okay? So again, it is probabilistic, which means that its findings are not expected to explain all the cases all the time. Again, if you bought this super great car that you're like, it's the best ever, you're like, well, that goes against it. That's true. That wasn't explained. Let's flip it upside down. The most reliable car you can think of, you go and buy it for that very reason. You said, I read the research. Dr. Woltel said, do research. And I got a car that broke down on day 7, right? What could happen to that, right? That's called, I think they call them lemons. I think here they talk about a bad egg. You just happen to have one bad product. And that happens because the laws of probability will tell you that that is the truth, right? Like it doesn't explain away every single possibility. It just explains away most, okay? So another example, your text goes into a lot of details with that. So the car one I kind of talked about already. But another one is your ability to discern faces and memorize people is often linked as if you're if they're age based, like age paired with your own age. So that is why if you have nieces and nephews and then they have friends over and they're like, oh, it's that one with the brown hair. And you're like, I don't know, they're 5-year-old. They all look the same to me. You're not being a horrible aunt or uncle. That's just because our brains are set up in a way that it is harder for us to tell people apart when they're not in our own age bracket. Flip it upside down. Grandma's at bingo and you're like, where is she sitting? I don't know. It's all similar hair. All these activities, guys, I just brought up a kids party and bingo. Those things aren't happening anymore right now, right? Such a bummer. We live in a weird world right now. But okay. So again, we could talk about memory for faces and have a ton of research on it, but that is not going to explain away everyone. For instance, preschool teachers, right? So their job is to be with kids day in and day out, and they're very, very good at discerning differences between their kids. Like they're not going to mess them up or go, oh, are you Tommy? They know them. Similarly, neonatal nurses, right, that are around infants all the time. I don't know about you, but like even my own kids, I was like, thank goodness you're in the room with me because you're all like little tiny babies. You look the same, right? But they have a special eye for it. So again, research is probabilistic. It does not mean it'll explain away every single variance or a piece of it, but most of the time, right? Okay. All right. So now we looked at research versus experience. Let's look at research versus intuition. Inherently, tuition is faulty thinking, right? If you're sitting at a stop sign, your phone's not working, you have no idea where you're going, and you're like, well, I don't know, turning left just feels right. Let's just turn left, right? What are your odds that you're going to be correct? If the choice was turn left or turn right?
50%.
50%, right? So you can kid yourself into thinking for a lot of life's choices that you have a really good gut feeling or good intuition because you have made a series of 50-50 decisions that went the right way. Usually, though, intuition is often based by motivation. So what you are motivated by is what you will go in the direction toward, and that is what's going to fuel that specific decision. Intuitive thinking is usually not fed through scientific reasoning. You are only almost having a knee-jerk reaction. We'll talk about some of those reasons why we're drawn to oftentimes make intuitive choices that you may go, I wonder why I thought that. And here's some reasons. So one is you could get swayed by a really good story, right? An old wives' tale, right? Anybody else? Anybody here like something that you're like, I do this all the time because I've heard that's what I should do. But if I pause and think about it, it doesn't make much sense. Anybody have a good one?
Like
I
for
don't know
snow
if this is
days.
a good one.
Oh, go ahead, McKenna. Sorry, hold on, Kat.
Like for snow days, like there's the put your pajamas like on inside out and backwards, put a spoon under your pillow, put an ice cube in the toilet, that kind of thing.
Yes, that kind of superstitious thinking that my kids destroyed our house the first year we lived in Michigan. They're like, but that's what we heard, Mom. We have to do it. Meantime, I'm like, please let them go to school. We're all working tomorrow. Yes, that's very much that. Okay, how about you, Kyle?
She kind of took mine.
Oh, she did. Okay, yes. Okay. Another one will be if you wash your face, you won't get pimples, right? Okay, so just wash your face all the time. What does that do? That takes away a lot of the oils. The idea is if you get a lot of acne because you have excess oil, bacteria gets in there and then that creates pimples. But is that the only way that you can break out? In other words, is washing your face foolproof against acne?
Nope.
No. What are some other things that might play a role in that?
Stress. Diet.
Genetics.
Yeah.
Right? Tons of stuff. But if you believe the TV, the ads, the magazines, right? They'll throw out numbers, 99% effective at treating all acne, right? Like, so again, your intuition may be, well, I've heard that it's kind of the right thing to do. And at face value, it doesn't sound wrong, right? You're like, I can see some logic in that. But that is not alone going to guarantee that that goes away. All right. Again, catharsis, like we talked about, talking will make you feel better. Not keeping your emotions in, that's the way to stay healthy. But as we just saw in the other study, quite the opposite ended up happening. So again, a good story, an old wives' tale, the reason why it's perpetuated is because it has some element that seems common sense or seem intuitive. So then heading in that same direction feels right? It feels like it should be the right thing to do. But when you pause and think about it and see other data, it goes against it. Again, being persuaded by what comes easily to mind. So this is a huge thing. If you're like, I hold this belief and everywhere around me, I'm seeing this thing happening, I am more likely to believe that that is to be true. That's what's called availability heuristics. Okay, you guys have likely talked about that in a lower class in psych, but that's exactly it. So if you just hear in the news that there's been a plane crash and you're about to fly, your belief that your flight might also crash is going to skyrocket, your anxiety, right? Because it just happened. So it seems more likely to happen again. But again, is that the truth? No, right? Like the probability, because we know with research, you have every time you take a flight, it's an instant. Well, asterisk next to that, events like 9/11, that day, the probability was higher because there was something going on in the world. But aside from that, from like mechanical errors, we know what the probabilities are. You know what's safe, what is less safe, in fact, driving a car, higher rates of accidents. But you don't think about that, right? You think about what's more lethal.
I mean, like with the airplane flying, I feel like it's different because if you're taking an airplane where they had no history of airplane falling down, you're more likely gonna feel safe than like taking the ones that had like couple airplanes going down, because you feel
That's-
like you.
So, but that, Noelle, that implies that we would somehow have knowledge of every mechanical failure or plane crash and then the type of aircraft that you're in. And I think some people are probably very well researched in that. Like that's their thing. They're going to look it up and know. But honestly, if you ask me right now, what were the type of aircrafts that have crashed recently or in the last 15 years? It's sad. The only thing I can come up with is Kobe Bryant and the helicopter. And I'm not sure that's a mechanical failure, and that's a helicopter. So you're not wrong. I think if you're somebody who's paying close attention as to past historical data, that might lead you into feeling like the probability of a crash in this is higher than the probability in this one. As to whether that is correct or not, and whether researchers would support that, I think we need to look at data on that too. Yeah. Okay. All right. Again, this is a fun one. What do we think is the greatest chance of death? Attack by shark or drowning in a tub?
Attacked by shark. Done.
Bold. Put it out there.
Yeah.
There's more of a chance that you're gonna drown in a tub because we use a tub more than we float around with sharks.
Yes.
the
One,
Shark Week.
one would hope that around this lake shore, there's not some of these great whites floating around. Totally. Right? Okay, so just at face value, the probability of you dying due to a shark attack, very, very little. The probability of you dying in a bathtub, also not huge, but much higher than of you being attacked by a shark. I have the stats here. Let me read them for you. Killed by a shark, 1 in 3.7 million. Itty bitty, right? Death in a bathtub, 1 in 800,000.
Now, question.
Yes.
Do
Answer.
And this is kind of like a sad thought, but are suicides recorded in that?
Oh yeah. So I don't know.
Okay. I you know, just checking, just questioning.
Or like, what if somebody was inebriated and then
Yeah.
drowned in their tub? Yeah.
Like someone slipped, hit their head on the tub.
Right.
Is it tub-related deaths?
So I wonder if these are both accidental death. But yeah. And I have another example in here that has to do with the flu and stats. And I'm just with COVID. I'm not going to go there. I'm not going to go there. Okay. So next slide. I want you guys to look at it. I'm going to put it on super quick. And I want you to see what is the color that you saw the most of. Got it? Everybody's good? Okay.
Mhm.
Okay. Those who thought did you guys all see it or did I go too fast? You saw it.
Yep, we
Okay.
saw it.
Somebody leaving me a mess? No. Okay. Those of you, what colors did you see? Just name it out.
Blue.
I saw yellow.
Blue. Blue.
I've
see
got a
red.
few more. Kyle, you said yellow.
Yeah, I think yellow.
Lauren and Katie said blue as well. We got a lot of blues. You guys, you broke my study. I'm kind of upset. Okay, let's look at it. You're absolutely correct. Blue is the highest number. So in my other research class, everyone said either orange or yellow. So why is it that people would name another color aside from blue?
It's
They're
flashy.
lighter.
It sticks out a bit more, right?
The blue
It's
is
easier to see. Because blue is the backdrop. That's the exact reason. It kind of all blends in. So again,
That's why I picked yellow. 'Cause
That's
I thought
why
the
what?
black drop. I thought yellow because the backdrop was blue, and I thought that was a trick.
no, but that's it. I mean, it kind of is, but you played right into my hand. Thank you, Kyle, because all the rest of you got it right. But that's exactly right. So if something sticks out, it seems different, you're going to pay attention to that more, right? That is one of the biggest errors with intuition as being the source of why you make a decision rather than research, because you are suspect or susceptible to this kind of availability heuristic. Because it pops out, it draws more attention, that's where you go to, right? When in fact, I mean, yellow to blue, what's the ratio? There's 6 yellow and am I counting 11 blue?
Yes.
11 blue. So, I mean, it's almost double. Again, not picking on you, Kyle. Most people say yellow.
No, you're all good.
I don't know. The rest of you guys, I got to watch out. I'm going to be killing this class. Awesome. Okay. Another problem with intuition and our faulty thinking is that we fail to think about things that we cannot see. If we can't see it, think about it, imagine it. If it's not part of the treatment group, we'll talk about that in just a second, then we kind of just ignore it, right? We go directly to that part of a graph that tells us, here's what I should be looking at, right? So we can think about the bad things that do happen, but we don't tend to think about the bad things that don't happen. So this would be the idea behind positive psychology or gratefulness, is that you don't spend enough time thinking about all the good in your life or so let's flip it, all the bad that didn't happen to you. Therefore, be grateful for what you have. It's kind of flipping the script a little bit on how we see the world, okay? We are not wired to think that way. We don't usually go to that level of thinking, like in the absence of pain, I should be grateful for what I have, right? Okay, so that's the same about scientific interpretation. So most graphs that you'll see are tables that talk about a treatment, they're testing out for a specific treatment. This is the cell that we want to pay attention to. That's where most people will be drawn to. So here, they had the treatment was present. They received a treatment and this is the outcome. They felt better, right? So changing that around a little bit, I had a headache. I was given this drug. Did I feel better? Yes or no? Okay. So I'm going to be interested in paying attention to this cell because that is the treatment was present and I felt better. Okay. The problem is if you only focus on that cell, what do you end up missing?
That there were more people who felt better that were absent.
Exactly. There are more people who ended up feeling better that didn't receive the treatment. Okay. So if I only focus on this present bias, meaning something happened, they felt bad, they were given a treatment, and then they felt better. If I only focus on that, I'm not seeing the whole picture. Okay. So when we do research, we have to pay attention to all the data, and we need to not get swayed by a researcher who may have a discussion that only focuses on this, because that is not telling the whole picture. Okay. Similarly, problem with intuition is we often will focus on the evidence that suits us best, that either aligns with our thinking, that confirms our previous hypothesis, and that's just what we go with, okay? I just had a really stern talk with a student. This is a dissertation student, and he just finished analyzing all his data. His hypothesis was that millennials showed greater levels of entitlement, okay? It's a very specific, I don't need to go in the weeds with all the details, but essentially every single one of his interpretive statement based on the interviews was like, oh, wow, see right here, there's clear evidence of entitlement. And I'm like, I'm not seeing it because I'm not going into it with that bias ahead of time. That I have decided that if you're between ages, whatever, I don't know what millennials are considered to be, 90s to, I don't even know. Somebody have insight on that?
I think it's like 79 to 99 or something like that.
Really?
Yeah, 'cause-
1979?
yeah, or 80 maybe, because my mom's a millennial and she was born in 80.
Oh,
And then I'm Gen Z, but I was born in 2002.
oh. You're like, I'm going to make myself a note because now I want to know.
I think I
Yes.
just Googled it, and it's 1981 to 1996 is millennials.
I'm having an identity crisis because
Yeah, there's some charts that will like, yeah, I'm at that cutoff, like 95. So it's like sometimes I'm in one chart and sometimes in another chart.
Who makes these charts?
I don't know. That's a good question. I always thought I was Gen X. I don't know why I thought that. And I thought millennials were after me. But maybe I am a millennial now. Oh, I need to go think of anyway. So his whole idea was millennials are entitled. He had this in his brain because in his experience, that's what he believed to be true. He believed that to be an accurate statement. And so you start research by some premise, some hypothesis that you want to test out. You find research that supports your idea, and then you go out into the field and gather data. The problem, though, is once you gather that data, you cannot constantly manipulate it to go, oh, yep, that fits what I wanted. That is bad research. So with intuition, we often end up doing that. We tell ourselves, oh, that's the same thing. Yeah, I'm only going to pay attention to that because that fits the mold that I believed. So you're cherry picking or only looking at data that supports your belief. So that is looking only at the evidence that you like the best. And next, you can also skew an entire data set or an entire experience if you are asking biased questions. So asking questions that are leading a participant down a path, very problematic, right? Because then you might end up getting results that feed into what your hypothesis was that may not be true. So I write on there clinicians and therapists because this was a huge issue at the time where hypnosis made a huge wave back in the 70s and 80s, where it'd be like, come in this calm state. And oftentimes a clinician would go, we need to do hypnosis because some of your symptoms, depression, anxiety, whatever it may be, we think is related to something traumatic that happened, right? Okay, so part one, clinician has a hypothesis as to the root of the behavior of the client. Clinician then engages the client in this relaxation hypnotic session where they're asking very, very leading questions. And again, clinicians would fall under that same category as we could say a parent or even cops, like they're an authority figure, right? So in that moment, oftentimes clients want to be pleasing and they want to follow through and say yes. And so there were tons of reports. There's a whole wave of psychology there where it got real ugly, where people were admitting to having had terrible trauma happen to them, children admitting to like being demonized in school, and there's lots of data out there. That was all faulty premise based on bad questions that were asked in a biased way that were leading participants down the wrong path. So if you have more questions about that, I can recommend a few books. Fascinating stuff. And Elizabeth Loftus spearheads a lot of this type of studies, sort of. She does a lot with eyewitness testimony and debunking how accurate we are at remembering what we've seen, especially in times of trauma, and how much police interrogation with leading questions can lead to faulty reports from eyewitnesses. Okay, I feel like I made a sharp right turn here, but anyway, interesting stuff. All right, so other areas where there's faulty thinking, being biased about being biased. This is one of the biggest areas because you think, oh yeah, well, other people are not able to be objective. The majority of people can't be objective, but I am special and unique, and I am excellent at remaining objective, right? So it's this idea of everybody else is biased, everybody else is incapable of being objective except myself, where I have this capacity to see things. Again, this is the same as saying like, well, I am above average intelligence and everybody else around me is just they're normal, they're regular, but I'm above average. Well, unless you have data that supports that, the laws of probability tell us what? You're probably average, right? Probably just like everybody else. So it is statistically impossible for all of us to think that we are special or above average, right? Statistically, that does not follow unless you're like having a Zoom meeting for like a Mensa member society, which I'm not sure that that's happening either, but you know what I mean? So our intuition, the fact that we think we are really good at something is faulty because usually we are just average. Oh, I think you're muted, Kyle.
Yep. Okay,
Yeah.
backtracking to the Mensa thing, is that the organization that like they can only be if they're like 140 IQ plus?
Yes.
Okay.
Yep.
Cool.
Good pull. All right. So again, when we rely on experience, when we rely on intuition, we make errors. It's faulty thinking. It's not accurate. Our gut does not beat out science. Science is stronger and more reliable. So it is why we should use comparison groups, why we should look at all data, not just cherry pick the one we have or the one that suits our beliefs the best. Okay, so this is kind of a perfect segue. On this, who do we have here? You guys know who that is? I think it says her name, Jenny McCarthy. Everybody familiar with Jenny McCarthy?
And Jim Carrey. Is that
And
is
Jim
that-
Carrey, they were dating at the time of that this was shown. So Jenny McCarthy, people familiar with her work? I mean, not her MTV work, but
Like Scientology or no?
Oh, that's Tom Cruise.
yeah, I'm not, she might be in Scientology. That's not what I'm pulling for here. It's with autism and vaccination.
Oh yeah, yep. I remember her.
Okay.
Yeah. mhm.
So let's unravel that for a quick moment. So what do we know about this claim of autism and vaccination in toddler age children?
There's like one or two published studies, or one famous one in like the early 2000s or the 90s that was published. And just because it's published, they looked at that and they said, here it is. This is what supports our claim, when there's an opposing like thousands of research studies that conclude that vaccines do not cause autism, but they'll look at that one and go from there.
Okay. So very good. Anybody else want to add anything to that? Like just what you know of that, vaccines, autism, how that came about.
I know that it became a really big trend after that, and then it kind of like people just started digging their feet in the ground, like anti-vax. Like I don't want my kid to turn out with autism.
Right.
That's all I know.
Okay. Anybody else? Okay. So specifically, it was the claim that after receiving the MMR vaccine, which is mumps,
Measles and rubella.
yes, those three. One, and that's done at age 2. Usually at a 2-year visit, a toddler would receive that. That then there were diagnoses of autism. So this is the claim. Previous to the vaccine, child is A-OK. Post-vaccine, child is not A-OK. Child shows signs of autism. What do we know about childhood development around that stage?
That's when things like autism can appear. And like we said about like the laundry detergent, just because you got the vaccine doesn't mean that your child wasn't predisposed to start showing symptoms of autism, like not making eye contact or stuff like that.
Yes. Okay, good.
Also-
Oh, sorry. I thought McKenna had her hand up.
You go. I talk a lot.
Okay, well, so I work at a daycare, and so a lot of times up until a kid is about 1.5 or 2, they're pretty equal with all their peers. And then once they get into like 2, 2.5, 3, that's when a lot of their social interaction begins, and you're able to tell if a kid is behind socially or show signs of autism when they're around the age of 2 or 3.
Exactly. Yeah. Because huge markers,
Now,
I mean, yeah, go ahead, Kyle.
No, you go.
No, I was going to say both Elizabeth and McKenna, you guys hit on some of those symptoms, right? So social interaction is one of them. The ability to relate, eye contact is a big piece. Language development is another. It is not uncommon for an 18-month-old to be fairly nonverbal, right? Like maybe a handful of words. No pediatrician would come down and say like, this kid needs speech therapy, right? It's fairly normative. Some kids are a bit more advanced. Some kids are a little slower. Again, we all fall in this middle ground of average. But right after age 2, 2.5, as McKenna pointed out, that's when a child should be able to decipher that mom or whoever is different than the cup. So I can play with the cup, I can play with mom, but my interaction socially with another human being looks different. I don't utilize them as an object, I actually interact with them. And so that is exactly at the time where you might see the early signs of it. And again, coincidentally, that is when the MMR vaccine is placed. Now, peeling it back another layer, autism is something that oftentimes, and I don't know who you guys are friends with on Facebook, but somehow I often see this on my Facebook page, like, and again, I'm not trying to stir the pot. You are entitled to whatever beliefs you have. I'm speaking only from a research space right now and a stats brain that I have, right? So it'll show 1900s, number of vaccines given and rates of autism, rates of ovarian cancer, and like, right? So like it's this chart and they're showing the greater the number of vaccines, the greater the presence of all of these diseases or disorders. Ergo, vaccines are causing more problems, right? Like that is the claim that these charts are showing. But now if I take away vaccines and I insert something else that has increased exponentially over time, what might be one of those things in the last 100 years that we've seen more of?
Population. Could it be that people are testing more for these things?
Okay, well, yes, that's a huge one right there. So awareness and testing and different standards. That I think is actually the main reason why things are increasing, right? What about technology or cell phones? We didn't have cell phones in the 1900s. Now almost all of us are holding one of these little guys in our hands. So is this actually causing ovarian cancer, right? As soon as I start pausing and I go on that, anybody else go like, well, that's stupid, or that's what? That's not right. Anybody else have that thought? Or
Yeah.
cars. There's more cars. There's
Diet
more.
is different.
There what?
Our diet is different.
Diet. Oh yeah. Let's insert that. GMOs. Right. I'm just gonna stir the whole pot today, and I'm being recorded, so this will be fun. But right, we can insert anything in there. There's more working mothers. There's cheaper clothing. There's more, like, right? People have more pets. There's greater number of immigrants in the country, possibly. Now I'm making stuff up, I'm like reaching. But we can insert almost anything that has changed over 100 years, and then we could replace that and go, see, this is it. But the thing with vaccine that has gotten more of a more traction, I should say, is because of that one study that Elizabeth was referring to. There was a study that showed here are children, they showed no signs of autism, they got the MMR vaccines, and then they showed signs of autism. Therefore, the vaccine caused the disorder.
Now, question. Sorry to interrupt.
That's okay.
But so kind of going off like all this is I don't know if this plays a part, but overdiagnosis of like ADHD, has that played a part in anti-vaxxing and like all that stuff, or is that just kind of an own entity?
No, then we go into that path about like, then we start having a fun class. So another class I teach is psychopharmacology for master's and doctoral level students. And this idea that pharmaceutical companies are now advertising not only to medical professionals who have the ability to prescribe, they're advertising to us as consumers, right? Because they have discovered, if I tell you, Kyle and McKenna and Elizabeth, and I'm picking on these two because they're the only three whose faces I see, but if I tell you, hey, you were like sad down the dumps, and now you get this pill and life is amazing, right? You as a consumer, you're like, sign me up for that. I want that. I want to feel that way. And the way our system works is patients have a lot of power, authority. They have, right? Like you can speak to your doctor and request a certain medication at times. And so that goes down the path of that discussion a little bit more, less about vaccination, is just more about patient power, autonomy, and the pharmaceutical company skipping doctors to then going straight to the consumer for advertising. Does that kind of answer?
Yeah, no.
Yeah,
That's
okay.
perfect.
Okay. So going back to that research article that links autism and vaccination, most researchers, if you are going to publish a paper, it goes through what's called peer review, right? So that means peers, fellow researchers, will read through your report, oftentimes even look through your data to make sure that they draw the same statistical conclusions. And then the best way to actually confirm or refute a past historical research finding is to replicate the study, right? So you do the study again, not with the same people. Obviously, that would be kind of impossible. Let's give you another MMR shot. Not doing that. But you'd grab another sample of toddlers. You would evaluate behavior pre-vaccine, give the vaccine, evaluate behavior post-vaccine. That happened multiple times after the release of that article, and no other researcher could replicate the findings. Now, you guys are smart people, you know about statistics. So there's this thing called standard error. Well, maybe there's something unique about that original, I think that's here, like the Dr. Offit, I think. Maybe there's something unique about the population or sample that he utilized that led to that. But what was actually discovered is that the data he had published was fabricated, completely false, wrong, bunko, like not right. Google it, research it. It's super interesting. But people latched onto that because they felt it was true to them. They believed it to be true because they saw their little Timmy, little kiddo be just fine and then not be fine. And the quickest way, the availability heuristic tells us that must be the reason, not the fact that developmentally, of course, that's when I would see it. That's far more complex, right? It's harder to blame development compared to vaccination. I have zero control over development. I have control over vaccination. So that's how it got some traction. Now, part of me bringing this up is to just talk about research in general, but the main issue is authority, right? So if I am a consumer, I'm a parent, I love my children, I want to make sure they're taking the best care, they're given the best advice. And I need to put my dog out 1 second. I'm going to make sure that I'm listening to people who have a right to be speaking, right? Who almost to say from the Hamilton line, like who have a right to be in the room and have that discussion. So I'm not going to listen to randos who might speak really loudly about their opinions because I don't necessarily care about their opinion. But all of a sudden, insert social media. There are some people that are famous, look at Jenny McCarthy, who became extremely loud, literally, to bring up this cause and got lots of people to follow her. So when you pause and think, who should I be listening to for medical type research and decisions? Is it, again, a celebrity, the president, the Pope, or medical researchers, right? I mean, when we have this discussion here, it seems like a no-brainer, medical researchers. But who is going to be the loudest? Who are we going to see the data the most from? If you're scrolling Facebook, you're on Instagram, even popular press, it's likely not going to be Mr. Geeky researcher who doesn't want to speak in front of the camera. It's going to be loudmouths and people who are in social media. So the moral of the story is always look at who the authority, who they are when they're speaking on a particular topic, because they may not have the right amount of authority in that specific topic to influence your decision one way or the other. Okay. All right. So when you are gathering sources of information, kind of starting at this, I believe, ... whatever the item is going to be, ask yourself, is it based on experience? If I believe something because of my own experience, no bueno. There's no comparison group. There's often going to be confounds. You're not certain why you're getting the answer. If you're saying, I believe in this because it just feels right. It just, in my heart, it just feels good. Think about that. Also crummy, because again, you're just believing an old wives' tale. It's just whatever's most readily available. It is based on faulty thinking, biased thinking. No good. Now, if you believe in something because somebody of significant authority told it to you, this may be green for go, unless that person has authority, but they're just basing it on their personal experience. I don't care about that either, right? I could have the best doctor tell me that he has never worn a seatbelt in his life and he hasn't died, therefore I shouldn't wear a seatbelt. He may be somebody I should trust because he has a certain level of authority, but that is only based on his experience. It is not based on research. Again, if that authority tells me you should do this because it feels right, doesn't it? Like it seems like that's the right choice to do. No good. We're not going there. You can follow an authority if it's based on their research findings in the area that they're an expert in, right? Again, you may have the best researcher on vaccination, then give you advice about nutrition. That may not be their, or how you should perform an appendectomy. That's probably not their area. Run, right? Okay, so then when should you believe in research? Well, if you believe in something because it is based on research, did you find it in a scientific journal or a scientific source, which would include a journal article that's been peer reviewed? It would include an edited chapter in a book, sometimes a full-length book. But if it is, in fact, hey, research tells me this, and you heard about it on the Huffington Post or on check newsflash at 7 p.m. tonight, is eating cheese going to kill you? Research says yes, right? Like that kind of popularized, like fear-mongering piece. Pause on that, because whatever they're qualifying as research and how they're interpreting what may be a very good research article, we'll talk about that in a minute, may be faulty as well. Okay, I've been doing a lot of talking. It's been an hour and a half of straight talking, but we're almost done with this. So we're just gonna power through. Obviously, you're all adults. If you need to go use the restroom, do that. You don't need my permission. If you need a glass of water, anything. Okay, so how do we go about finding and reading research? So first, you have to consult scientific sources. So for you guys, going to the library's website, looking at databases, that's going to be very important. You can sometimes use popular media to kind of be a jumping board for you to get some ideas. But really, it should start in a research database. That's the first place you should go. This is a list of some of the APA approved journals. You'll find in here both empirical journal articles. Those are empirical studies that have been done. It may also include meta-analysis. That's when a researcher will gather all of the research that's been published on a particular topic, and then they'll write out their results on what they found, kind of summarizing things. That's fine too, because it comes again from a place of research. You may find them in a textbook. My only little pause on that is that as soon as a book is published, you press pause and you start kind of the expiration clock on it, because articles are going to age out. New research is going to come out, and that's not going to be found in that book. So there can still be very good value, but I wouldn't write an entire research paper based solely on books, because chances are your data is going to be very dated. Okay. How can you go about finding those scientific sources? So if you go into your database on Aquinas's website, these are good databases to look into: PsycInfo, ProQuest, and PubMed. You can also search on Google Scholar. Oftentimes you can type up a topic and write .pdf afterwards, and you'll get some full-length article as well. And then visiting an author's webpage, that's always a good bet too, because they love to share their research because they think it's awesome. So that's another good way to go. All right. When you are reading a research article, this is what you will find in almost every single one of them. These are the components that you will see. So it'll start with an abstract, which is a short synopsis. And in this class, just read the abstract and read nothing else, and you will know exactly what you're talking about. No, right? Like so many times students are like, yeah, I picked this article. And I'm like, oh, did you read the whole thing? Oh, yeah, I did. I'm like, because I did too. And the results are in direct opposition to what you're trying to show me. They are? Well, yes, because you just read the abstract and you stop there, right? We are not going to do that. So for this class, especially where we're working on a research paper, these are the exact sections that you will have in your research paper as well. Short of the abstract, you guys can skip that. That to me is not an important bit. But it is absolutely appropriate to read the abstract to determine if this is an article that is worth to add into your reference list. Totally fine. But if you decide from there, yes, it should be, then please go and read on again. So read the introduction, see how they formulate their thoughts in literature review. Make sure that you read the methods section. How do they plan on running the study? Now my other dog needs to go out. Go. And then see how they write up their results. How do they talk about the statistics? What did they find? And lastly, go into the discussion and what summary or what conclusions did they draw? And do you draw the same conclusions? It's okay if you're like, well, I read the stats and I came to a different understanding. That's fine. Talk about that. So these are the parts of a research article that'll be included. Okay, reading with a purpose. This is the whole point of the of the article critique that you guys are turning in this week, is to be able to read a journal article and really pull out what is most important in it. What is the theory they're talking about? What's their hypothesis? What are they thinking is going to happen, right? What are they predicting? What results did they gather? How did they go about gathering those results? Did it seem like sound methodology? Things like that. So this is how you become a critical reader of research, by really looking at it through this lens. Okay, so lastly, if you're looking for other ways to find research articles that are not just in databases, you can always go to a bookstore or to the library, like physical shelves, and look at the back of the book, make sure that they have multiple references, that it's not just, I've had this twice now. When I was an undergrad, I had a research professor who wrote their own book, and the reference in the back had a reference of their past book. I'm like, well, I'm in an echo chamber here, right? Like, it's just what he thinks. That's not going to be very good. So you want to make sure that there's going to be multiple points of view that are being covered. Try to avoid Wikipedia. That is not a source of research. Same with, again, and I say Huffington Post because no joke, I had somebody cite that as a reference, like found in the Huffington Post. That is not a source of good scholarly paper. Now, you may find an article and it cites a research article, but then go and find that, right? Go find the primary source, not whatever this journalist is telling you what to think.
If we find, like, sometimes I'll run into in a research paper, like, I'm looking for like a general, I don't know, like a general idea or statement that is sort of universally accepted, but there's not like a whole research paper on it. I don't know. If you find that general, like that general piece of information, like just
so I
like
think I see what you
mean,
like
is or something like that, like something very general that we don't need a bunch of, like, do you have to cite someone, I don't know what I'm trying to say here. Like general information. As
an example, taking methamphetamines, bad idea, right? Okay, general agreed upon. Like, do you need to find a research article that tested it out? They gave meth to somebody and saw the negative effects.
Yeah.
Probably not. I don't think you need to go that far, but you could cite a book on substance abuse and the decay, right? And they may have a chapter discussing exactly that. That would be
Okay.
appropriate.
All right.
But I would not go and cite, again, Huffington Post or Wikipedia says smoking meth is bad. Right. No, we're not doing that. So yeah, good
Okay.
question. Okay. Oh, okay. So it is 2:35. If you guys want to come back, well, actually, we're not going to be coming back as a group. What we're doing is we're going to be watching the Goldacre article, or not article, TED Talk. Okay. Gosh, I lost you. Where are you? Here you are. Okay. I want to make sure that you guys can find it because it's somehow it got hidden. I don't know how that happened. Okay, I'm going to link it again so that you guys can all see it, and I want to share it with you all. This is not the right class. Here's the right class. Sorry, bear with me. I have too many classes opened. Okay. Page. Okay. All right, so this TED Talk is excellent, but it's gonna stir some stuff in you. So go into it knowing that. Here, I wanna make sure that now you can see what I'm looking at. Okay, do you guys see this Goldacre? Yes, okay. So you'll click here and then just copy this in your browser and you'll get this. It's a guy from the UK that talks, he's an epidemiologist, and he will discuss how research is done, how people are fed research, how good research is often buried because the way it gets described to the general population, they just take one tiny little finding in the research, they cherry pick it, and then that's what they disseminate to everybody else. And then you'll talk about specifically with psychopharmacology, some of the dangers with research that gets shut down, meaning negative results of a research that show that a particular medication is not helpful. The research never gets to see the light of day. It gets completely omitted, and how problematic that is in our world. So my challenge to all of you, or my task for the rest of our class, is to watch this as a short video. It's like 15 minutes. But then I'm going to have a discussion board right below it where I want you guys to engage. Again, not just throughout the rest of today, because there's a couple students that are out today for other reasons. But you'll have until next week to meaningfully engage with one another as to your thoughts on this video. By meaningfully, I want you guys to each have your own individual post. This will be more like a typical online class discussion. So create your own post on what you thought about the video, and then respond to at least 2 colleagues as to what they thought of the video. So this goes towards your participation points for the class. We will do this occasionally in class. I think it allows everyone to take a turn kind of speaking, whereas in this kind of format, not everyone always speaks. So take that as your opportunity. So again, watch the video, create your own individual post as to what struck you, what was shocking, what were you surprised by, just your general feelings about what was discussed, questions you may have furthering on, like going on after that. And then make sure to respond to at least 2 students by next week at the same time. Questions?
So we're coming back after the break and watching it together on our own time.
No, this is it. This is it for today. We went through our entire lecture for today. You guys can do this during the rest of our class time. I think that makes the most sense because we still have a little bit of time still for the class time. But there's some of you that are not here, so that's why I'm giving a slightly longer extension to complete
So
it.
basically, we just have to have read it and made a post and responded to 2 people by next week.
Yes, and it's not reading, it's just watching and listening. Yeah.
Did I
That's
say
the-
reading? Yeah, watching.
Yeah, that's okay. Yeah. McKenna?
And that's the only thing due for next week, correct?
Yes, if you have not completed your article critique, make sure that you get that done. I'm extending it until end of Friday. If you somehow got mistaken with the syllabus, Also, by next week, you need to make sure to have your certificate for human research completion. So make sure you get that done as well. And that you go on the discussion board for the topics for the research paper. Make sure you get that done as well. And that's it.
Quick question about the research methods in psychology.
Yes.
What is the binned in access? Because I was looking through like the online Aquinas like bookstore stuff, and it has like an access code like with it, and I didn't know.
Yeah, I was also trying because I wasn't sure what like the course ID or anything was that we're supposed to put in.
You ask interesting questions. Okay, so this is specifically, sorry, I just pulled up the syllabus here. So this is in regards to Morling, the textbook for Morling?
Yeah, so like on the Aquinas bookstore, it says like,
book.
yeah, that one.
Yeah.
And thanks to McKenna, the cool TikTok site thing, I have the book. But
It's on TikTok? That's cool.
I know.
Okay.
But so it says like a access, and I just wanted to double check if I needed to buy that to do something.
So then it sounds like, if I'm hearing you correctly, if you click the free link for the book, they do require you to have an access code.
No. So like McKenna's thing works completely. Like it gives you the entire PDF of the book. So it's perfect. But on course or on the Aquinas bookstore, it like it's book with an access, like binned in access.
Yeah.
I have no idea what that means.
Okay, well, fantastic. If you don't, then it probably doesn't matter.
I don't think you need it. Those are like for different teachers. They usually have that because they sign homework through the book, and then you can log in with a code to do that work. But I don't think in this class we need it.
Fantastic. Awesome.
Don't. No, you just need access to this book. And honestly, so much of my lectures, I mean, you will see directly in here, like, okay, I was able to get the pictures. Like this is when we talked about the tape and the example of a personal experience. So that's all you need. And then that's why I put the recommended text for SPSS, because we're not even using SPSS this semester since we don't have access to it. So you don't even need that textbook either.
Perfect.
But good question, because it sounds like Narelle had the same question as well. So thanks for asking.
Awesome.
Any other questions?
No.
Okie dokie. Enjoy the video. Take a walk after. Don't get too bummed out about the world. It'll be okay.
Oh,
Okay.
also, quick question. Sorry.
No, don't apologize.
When is the second article critique isn't due next week again, or?
No. Let me pull that up because
I just wasn't sure if it was like back to back.
no.
Like one due this week, one.
I want to say it's week 4, but I'm not 100%. So let me pull up our syllabus again. I don't know why this syllabus is closed. And I'm going to share. Oh. No. Oh, here it is. Okay. Can you guys see the syllabus? Do you see it or no?
Yes.
Okay.
Yeah.
So your faces are in the way. Let me close this up. Okay. So we've got the article critique is due this week. That's week 2. And article critique 2 is due week 5.
Oh, okay. Thank you.
Which I believe is like, what is that? So 2, 3, 4, 5, the 17th of February.
Okay. All right. I was just wondering. Thank you.
Yeah. And obviously there is no fall break. I think we talked about that. That's going to be the week of your qualitative assessment. Oh, and actually that brings us up too. I think I had a couple emails, maybe not in this class. It might've been in the other research class, but I think you guys will benefit from this too. When you think about doing your project for your research paper, it needs to be quantitative, which means it needs to be something you give a survey to somebody. And it is not going to be in person. It's likely going to be, here, lovely Facebook friends of mine, could you please complete this? It's for a class, be kind. So you are not actually going to be observing data. You're not going to be doing any sort of qualitative assessment. The qualitative research is going to be completely separate from the research paper as a whole. So if you're thinking it would make it more rich if I had both pieces of information, first off, you make my day because that's amazing. And yes, you are correct. That would be more rich. That would be mixed method. It'd be both qualitative and quantitative. But for the purpose of this class, this is way beyond what we have time or resources to do. So if you're thinking of a topic, which you should be for the research paper, it should be something that you can ask questions about and have a short survey. It is not going to be something that you observe a certain behavior in people.
So
Does
will
that-
we go over the next time we're together, like the discussion board, and be like, okay, this person is going to be like our groups a little more?
Yes. So my goal is that over this course of this week, not only do you guys talk about topics, but I want to see, especially because I think, was it Ashley who was like, yeah, Kyle and I are in our group. So that needs to be spelled out. Because again, we have 3 groups of 3 students, 1 group of 4 students. So I need to know who's in each group, because then I categorize you guys, and then we're going to set up times to meet just the 3 or 4 of you and myself. So I need to know that by next week. Okay. Cool. All right, we good to go?
Awesome.
All right, enjoy your week, enjoy the video, and we'll see you next week.
Thanks so much.
Thank
Bye.
you.